Unhealthy eating habits have contributed to a lot of health problems epidemic today. Health problems like diabetes, high blood pressure, osteoporosis, arthritis, cancer, health disease, and so on. The good news is, if you can control what goes into your mouth and your body, you will live your best. For what you put into your mouth determines how well or sick you live. You and I know that poor diet is associated with major health risks that causes illness and even death. So, by making smart food choices today can help you protect yourself from all these health problems. Our integrative nutrition health specialist, Miss Betty Olayinka Folani Akinlosotu, aka Bufa, wants to see you living your best without any health issues. She made this known in her program showing every Sunday on Healthy Living with Bufa TV. She tells us how our food choice affects our health and how we feel today, tomorrow, and in the future. If you are opting for optimal health, from fighting free radicals to living your way into a healthy and beautiful body, here are some things you must do. Eat a nutritious, healthy, balanced diet every day. Practice your daily exercise and take your supplements, especially vitamin D, vitamin C, zinc, and chlorophyll to boost your immune system against free radicals that cause cancer and other diseases. Join us on this program every Sunday, 1:30 p.m. US time, 7:30 p.m. African time, and 6:30 p.m. United Kingdom time, where she educates on health and nutrition as well as features professionals from various fields to sensitize you on wellness. See you there.
Welcome back to Healthy Living with Bofa. Hello, everyone, and thank you all for joining us today. Again, as usual, this is Healthy Living with Bofa, streaming live on YouTube channel. And at this time, I just have to do this. I just have to appreciate you all for this love, the support you've been giving us on this program. So we want to use this opportunity to appreciate all our viewers, our supporters, for your dedication, your love for this program. For those of you that always leave us comments every Sunday, my goodness, you are awesome. You are beautiful. You are nice. You're great. I don't know what to say. I just want to say a big thanks to you all. And I cannot mention names at this time because of our time. We have limited time and we want to keep the show within 1 hour so that we can all go and prepare for tomorrow's, activities. So for those that are joining us for the first time, we want to say thank you. For returning viewers, we want to say thank you as well. God bless you all. Okay, who is this adorable girl on your screen today? Because many people call me girl, and seriously, I accept. Okay, it's no one but your friend, Betty Olayinka Folani Akinlosotu, aka Bofa, bringing to you live information you all need on health and wellness. And that is the power of healthy food right here on your screen in action. So I will implore you to eat good so that you can look good. Seriously, I mean it. Okay, last week, after the show, I received many calls after the show. And what was the call all about? The call was just about my people asking me to bring back on the show today the kitchen herbal remedies we discussed on the show last Sunday, and I promised I would do so. So in few minutes, I will be showing you these apps on nutrition segment, not on any other segment, but nutrition segment. And let me tell you this, most of these apps, the one that I mentioned last time, last week on the program would be on our today's nutrition tips. So even if you don't ask me, I'm still going to tell you all this. I'm going to repeat it because it has to do with infections. And today on health, we are treating sexually transmitted disease, STD, on both health segment and at the same time on the nutrition segment. What do we do to, once we get this infection, STD, any sexually transmitted disease, what are the home remedy you can do before you visit your doctor? This is what we're going to be treating on nutrition segment today. So I'll actually be repeating the same thing that I mentioned last week on the program, but trust me, I have them available to show you today, like I promised. I'll do the same thing. So today we have on the program an adorable mother from healthcare management field. She will be joining us shortly today from UK on interview with experts. And right now it's Health Corner. Interview with expert comes right after that. Thanks for watching Healthy Living with Bofa. Stay with us. And don't forget, we're going to be asking questions today on this. So get ready for that. And I'm sure you will get the answer right. So let's have a Health Corner. And after that, we come back to us. Interview.
Back to Healthy Living with Bofa channel. Last week, we discussed contagious infections. This week, we are going to be deep diving into an area around contagious infection. And this week's topic is sexually transmitted diseases. Now let's jump into it. What is a STD? A STD is a sexually transmitted disease, which are considered to be contagious conditions that can be passed off from one person to the other through intimate sexual contact. In fact, STDs affect both males and females regardless of age, gender, or location. Types of STDs are the following. Number 1, human immunodeficiency virus, also known as HIV, and acquired immune deficiency syndrome, also known as AIDS, which can also aspire from HIV and progress into AIDS later on, depending on how severe the condition is. Number 2, chlamydia. Number 3, gonorrhea. Number 4, pelvic inflammatory disease, also known as PID. Number 5, genital warts and human papillomavirus, also Number 6, genital herpes, also known as HSV-1 or HSV-2. Number 7, syphilis. Number 8, herpes. And number 9, trichomoniasis. Now let's look at our signs and symptoms that might indicate a STI. The following are: number 1, sores or bumps on the genital area or in the oral and rectal area. Number 2, painful or burning urination. Number 3, discharge from the penis. Number 4, unusual or odd smelling vaginal discharge. Number 5, unusual vaginal bleeding. Number 6, pain during sex. Number 7, sore, swollen lymph nodes, particularly in the groin, but sometimes more widespread. Number 8, lower abdominal pain. Number 9, fever. Lastly, rash over the trunk, hands, or feet. What happens if not treated? Keep in mind, sexually transmitted diseases aren't only an embarrassment. Now, when we say embarrassment, those who have it may feel a certain lack of confidence when engaging into sexual activities. If they remain untreated, some of them can cause infertility and even death when they turn into HIV or AIDS. Therefore, it is always important to get yourself tested as soon as possible. While practicing safe sex can be the most efficient way to avoid these infections, doing that with an unhealthy lifestyle would still be useless. To understand STDs in general, try to learn the facts and protect yourself. Now, how easy is it to catch an STD? Well, first, you can get an STD from vaginal, anal, or oral sex. Then you can also be infected with trichomoniasis through contact with the damp or moist objects such as towels, wet clothing, or toilet seats, although it's more commonly spread by sexual contact. Then lastly, you are at high risk if you have more than one sexual partner. Now, treatments. Number 1, antibiotics. Antibiotics in a single dose can cure many sexual transmitted bacterial and parasite infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. Secondly, antiviral drugs. If you have herpes or HIV, you'll be prescribed an antiviral drug. Now, let's look at our key takeaways. Number 1, mainly sexual transmitted diseases, also known as STDs, can be spread through oral sex. Number 2, using a condom, dental dam, or other barrier methods every time you have oral sex can reduce the risk of giving or getting an STD. Then, lastly, there is little to no risk of getting or transmitting HIV from oral sex. That is all we have for you this week. Remember, I love you, God loves you, and love yourself.
Wow, that's awesome. You see, we bring a lot of information on the program when it comes to health, because that's exactly what we need. And many people are suffering underneath. They are suffering in their closets, simple things that can be treated on time. But because they lack information, they don't have any understanding of what to do to cure this thing or to stop it on time before it gets worse. And this is what we're doing on this program, to teach, educate, and also sensitize you on just few minor health problems that can escalate to a big deal. So on this program, I would just advise we all join every Sunday to learn some of the information we're going to be giving on this program. It is very important we do so. So welcome back to Interview with Expert, the segment we don't want to miss, and the segment we've all been waiting for. Obviously, healthcare in Nigeria is poorly managed compared to other countries, even within the continent. I mean, Africa. Why? Because of the inability of the government to prioritize the sector. I guess because they have forgotten that our health comes first. And there's a slang we do say in nutritional world, and that says, go healthy and happy. Shape it up. Life without health is like a hell without nothing. Without health, life is almost dead. So, a healthy body holds a healthy soul and mind. Today, we will be discussing on healthcare management. And our guest on the program today is our mother, Ambassador Prophetess Ajoke Okubadejo. Prophetess Ajoke is a United Nations ambassador, a health management professional. She has a higher diploma in child care and education, disability, and special needs at Lombard College in UK. She obtained a diploma in therapeutic counseling at Backford Center, UK, and a HND in healthcare management at Harding University in UK as well. Ambassador Ajoke Okubadejo is a writer, a Christian counselor, and a philanthropist. Before I bring her on the show, let's take a break, and when we return, our mother will be joining us. So let's take a break. After the break, we will be having our mother on the show today.
Wow. This is all what we've been waiting for. There is this saying that you are what you eat. This is absolutely correct. See, eating right is when we get all the essential nutrients our body needs from the food we eat daily. And these are minerals, vitamins, fats, healthy carbs, proteins, and fiber. Question we should be asking ourselves is, have I been feeding my body with essential nutrients? Many people have been advised to stay away from certain food. Why? Because they are very high in carbohydrates. But the study shows that your body system needs carbohydrates, which we call energy food. What is important is to go for healthy carbohydrates. Now, you have just one food item that can supply your body system with all these nutrients. And this food is called turmeric gari, trademark as gari didun. Turmeric gari, developed by Ajoke groups and made from gari, turmeric, coconut, lemongrass extract is the product of an effort to enrich the nutritional value of gari, and the nutrients you get from it includes healthy carbs, minerals, vitamins, fats, proteins, and fiber. So whether you are super healthy, have diabetes, high blood pressure, and other healthy related conditions, the nutrition advice is to go for turmeric gari. You can eat directly as snack, soak in water, or make and enjoy as swallow. Eba. I promise you, you will love turmeric gari. To have a sample, can reach out to Bird and Brewem Services, New York, United States at this phone number 34761-35485 for distributorship in the United States. Please contact Gito Terminal African Market at this phone number 929-283-2653. For Nigerian market, please contact Ajoke Groups at 292 Muritala Mohammed Way, Alagomeji, Yaba, Lagos, or contact them on phone 070-5656-5659 or 081-337-2939. Turmeric gari, you will love it.
Okay, right here on your screen, it's our mother.
Okay. Hello.
Our pretty mother, a wonderful mother. Can you now see what I'm talking about? She is beautiful, both in and out of her. You need to know her to know what I'm talking about, that it's true. So today we have on the program Ambassador Prophetess Ajoke Okubadijo. You're welcome on the program.
Thank you very much. Hello, everybody.
Thank you, thank you. So without wasting much of our time, let's get started by knowing who is this adorable mother on our screen. Tell us about healthcare management. What is it all about? Why this area of healthcare, and what type of service that you provide in this field? And this will lead us to know you, who you are in this field.
Well, as you know, I've been introduced. I'm an ambassador of the United Nations, Prophetess Ajoke Okubadijo. You know, the healthcare and healthcare management is an area that I have a passion for. So I have launched out deeply into it. And healthcare management, it's about leading, leading in healthcare. is about looking into the healthcare, the service and the provision that's been provided for people. Looking at the resources, looking at the care package, looking at commissioning, looking at statistics, looking at policies and procedures. So it entails a lot of things.
Wow, that's right. I'm also in this field. My first degree is in healthcare management.
Lovely.
Yes. So we are both leaders when it comes to, healthcare management. And you see, without us, no doctor can function well, right? Okay. So now we know you to be a minister, in fact, a founder of a church right there in the UK. How did you manage to do it? Being a minister in church and healthcare professional, how did you manage to fill the gap and still provide your other job with adequate attention?
I would say first, it's about supernatural ability, wisdom of God. There's nothing you can do without God giving you the grace to do it. As a woman of God, I believe in that strongly. But having said that, I have a heart of caring. I have a passion to care for people. So that stemmed from, that is where it stemmed from. I went into this field early from the foundation by being a carer, going to care for people, support them at home, support them in the hospitals and all that. So from there, I developed a stronger passion to go further. And along the way in my journey, I had a calling that sort of intercepted that. So what do? I still have a heart of caring. I don't want to let people down. At the same time, I have to answer the call of God. So that is where the supernatural ability came in. I got that enablement from God, that nothing is suffering. I'm doing the work of God. I'm studying, to further more, and I still work, to support the people.
Wow. So, I guess it's because the power of God is involved in all you do. That is exactly the reason why you are able to maximize, to prioritize, to do so many things at the same time. God bless your soul, ma. Now, let's go deep into your profession. You are into many professions. And when I saw your profile, I was like, wow. You study healthcare management, childcare, education, disability, and special needs. My goodness, this is beautiful, beautiful. Congratulations, ma. So now, let's go deep into that. How will you describe childcare system in the UK, especially in disability community, compared to Nigeria childcare system? I know you may not really know what is going on in Nigeria, but just let us into the one that happened, that usually you have experience in the UK. That will tell us how our own should be in our motherland. So go ahead, ma. How will you describe
I would say childcare, even though I'm not a childcare practitioner, but I have that qualification. That was my first qualification in UK. I would say that I don't know about Nigeria, but childcare is a specialist field. It's a specialist learning field that you cannot embark on without having appropriate training and supervision. And apart from going to gain knowledge in the higher institution, you still have to have the foundation by having work experience. They want to see that you have the qualification backed with work experience before they can entrust you with the care of any child in the UK. Be it you want to go and work in the hospital, you want to work in the nursery, or you want to start your own private practice, you still have to have that, sound and deep knowledge, and you still have to have that, work experience in that field. And the major area when it comes to disability for children is that it's physical, mental, emotional, so it involves a lot of things. So you need training in terms of disability to be able to handle a child that has autistic. You know that they can be difficult. You need training in terms of physical disability in order to be able to carry them, support them with their hoist or wheelchair or this and that. So it's not something you can just diversify into. You have to really have all the right training to be able to support. And there are policies and procedures in place as well. And you have inspectors, you have supervisors You have the National Health Service, you have the social services that sort of look into what you are doing and the service you are rendering.
Okay.
When it comes to disability as
So
well.
if you have all that in place, how is the government taking care of this community? I mean, the child or the children and the persons living with disability. What are the care, the service, the benefits, all those things?
They have what we call there's a department called the social services that have policies and procedures in place of the I would say of the provision that should be given to children that have all these needs, and that provision is being governed by people that are experts. Even in terms of this, my field, the healthcare management, we have people in a leadership position that are overseeing that, whereby they give them all the resources and the support they need to be able to live like anybody else in the community, in terms of having a carer for them, a care package, in terms of having a social worker from the Office of the Social Services that sort of oversees even what the parents and people that are caring for them are doing. They have what we call healthcare review, where they come and visit and review the support that they are giving. If it's working, if it's not working, they need to reduce it, or if they need to increase it. So all this, it's in place. And then we now have people in terms of leadership that oversees people that are working directly and indirectly with all these people.
Wow.
So
wow.
It's a thing that is properly and well taken care of.
I would say it's the same thing here in the US. There may be a little different because of the government in the system, but seriously, all you said are the same thing that is going on here, that happens here. And I'm not sure if we have the same thing. Maybe when we have somebody coming from Nigeria in your profession, we will be able to ask that question properly, and they will be able to tell us what is going on in Nigeria. Because you and I don't live in Nigeria, we don't know how it works, except if we travel, little period of time that we stay there, we can know all. So I'm just going to say, God bless you for asking me that question. Now, we both know that some challenges will prevent proper management in healthcare system. We know that as a leader in this profession. What are the problems or challenges facing healthcare management in Nigeria? Can you please tell us a few?
I would say that's very deep. The first thing is weak justice system. That's number one. Weak justice system. If the system is like, I live in the UK, I see the justice system. Before you turn to the left or right, I mean, we're talking of childcare now. There's something we call child protection. There's something we call safeguarding. There's something we call protection of vulnerable adults. Where are all this in Nigeria in place? Where are all these type of policies and procedures? So we have, looking at the justice system, I'm not saying they're not trying, but there's still a lot to be done. And it's not the job of one person. All hands have to be on deck. Even the citizens too have to be ready and have to be cooperative for the government to be able to give the right, support. So I look at the justice system. Then I look at, we should look at misplaced priority as well. They're spending resources sometimes in the wrong direction. Healthcare system of the people is very paramount.
That's right.
I know that there are bad roads, but shouldn't we first of all take care of the healthcare system so that the drivers on the road are even sane to be able to drive properly? When they should be going right, they're not going left due to depression, anxiety. They are anxious to chase that little money. So misplaced priority is another one. Spending the budget on the right thing at the right time. That is what I call, misplaced priority. Then we look at the lack of resources as well. If I am a medical doctor and there are not enough equipment for me to function, the resources are not enough, a lot of people will suffer in my hands.
That's right.
Lack of resources could be lack of funds to buy the equipment.
That's true.
Lack of resources could even be lack of qualified doctors, experts in that field. So there are so many things that needs to be looked into and taken care of. And the other thing is that there should be joint effort. Education. There should be free education so that the people can go and learn in order to become an expert to support the country, their citizens.
That's true.
And that education should be free. It should be universal, like the UK. It should be free to some extent, at least up to secondary level. It should be free. Because if you look at child development, from research, we discover that children coming up from the age of becoming teen, that is when they start forming and picking characters from their environment. For if the parents are not there to give it to them, they learn from their environment. They learn from what they see. They emulate others. So if the secondary education in Nigeria is free, it will go a long way to help that country as well.
That's true. Thank you so much, Ma. We've been saying this on the program for a very long time because we deal with health on this program. And I hope one day things change in Nigeria. Will this happen? It starts from us. It starts from us individually, and that's my belief, and I'll keep saying that. We all believe that government cannot do everything, even we are in diaspora. It's not government that is doing everything for us. Individually, we are helping one another. So if that change starts from us, I believe the government will leave their arms to do what is right. Thank you so much. Now, healthcare management is exactly what the name implies. It is the overall management of a healthcare facility such as clinics or hospitals. You and I are in charge of ensuring, that's why I said the change starts from us. We are in charge of ensuring a healthcare facility is running as it should in terms of budget, in terms of the goals of the facilities practitioners and the needs of the community, like you said. And the question is this: what do we do to make it work, to prevent poor and ensure proper management in healthcare system in our country?
Yes, the first thing is we should have the right people that are experts in this field in order to alleviate corruption. It will work if the government are working, have a joint effort with the citizen. First is that we must be disciplined. The little that government is even providing, is it going round? Is it going far? Are people not abusing it? It's like it's not there. We can't even say it. So the first thing is discipline, for people to be ready to support the government as well. For government to put something in place, put people like, in terms of healthcare management, people that are well read to know and to study, to see, and to identify where abuse is coming in and to curb it. So that even the little that government have to provide, because if you look at Nigeria, it's overpopulated.
That's right.
So there's not enough, even though we have, if you look at the World Health Organization, they support Africa in order to better the healthcare system, in order to better the delivery of the healthcare system. Now, the resources, I'm just going to use that as example, the resources that, the provision that they're giving, is it going around and where is it going? So all these things, we need people, the right leaders in place in terms of monitoring, budgeting, financial control. We have things that we call protection of abuse here. There should be a body that does that, not only NAFDAC, not only these people that chase corruption, because they're corrupt too. So there's a lot to do, really. It's not a job that can be done in 1 year.
That's true. I agree with you, Ma. At this time, I'll quickly read out the comments people are sending to you on our YouTube channel. I'm going to start from Mr. Wale Akintade. Mr. Wale Akintade says, good evening, ma. You're welcome on the program. Mr. Tolulokwe Ayorinde says, good afternoon to everyone. Dr. Oluwatosin Akinshola says, good evening, everyone, Beaufort TV. Pastor Solomon Bade Geshin says, hello, good afternoon, and thank you for coming. And Mr. Honorable Wale Adelano says, nice to have you again, and says, Ambassador Mrs. Ajoke Okubadejo, you are welcome on the program. At this time, I have to let our viewers know that Honorable Adewale is the connection between us. is my body, is my man, my everything, is the one that introduced our mother to us. So thank you so much, sir. God bless you. And
Hello,
UTech Entertainment says, keep flag flying, ma, and God bless you. And
Amen.
Mr. Fagbemi says that, well done. Thank you for coming on the program. These are the comments we are getting from our viewers. So at this time, we are going to go straight again to the same topic we are treating. Now, how do you see the future of healthcare, both in Nigeria and in the whole Africa?
I would say, even being a woman of God, there's hope. It's hopeful. There is a lot that's coming into Africa. Even we're not going to look at just Africa now, we're looking at even foreigners, outsiders are coming in to support. I would use myself as example. I went into this study because I saw a case of abuse with the death of my mother. And that prompted me to going further to study healthcare. Even though I've been in this field for donkey years, it was after my mom's death 4 years ago that I said, look, they need me in Nigeria. I need to be able to put my own quota in after some time. So I went into leadership level of study in doing healthcare management. And what does that mean? My mom was diagnosed that she has cancer. Let me cut it short. She died and I requested for a postmortem. And when I requested, they gave me the postmortem result as abscess. That was what killed my mother. And we were nursing cancer. We were buying drugs in the hospital. We were paying for this and that. So that really sort of got me upset. So now I'm abroad. I'm in UK. I've gone to gain knowledge to come and contribute my own quota at some point, even though I'm a woman of God, even on a voluntary basis. So there, Nigeria, apart from Nigeria, Africa, there is hope. A lot of people have awareness now. Even people that have traveled out, even foreigners are coming in to invest into our healthcare system. So I see that there is hope. And then I see joint efforts happening gradually. From what you saw that the youth did not long ago, you would see that people are now speaking out. There's awareness everywhere. Yes. So there's hope. And there are investors coming in to invest, medical equipment, houses, schools, and all that. So I see that things are getting better. Yeah.
So in regards to our doctor relocating, to another country, what will you say to that? What is your advice to the government? Not to the doctor that is locating, because there's nothing we can say to them to stay behind because they don't have enough resources. And again, they are not well compensated. So we are not going to hold them to stay back while we are in another country. So I want you to direct your advice to our government. Seriously, what would you say to our doctors that are relocating away from our country instead of staying back to take care of the country?
Doctors, I would say, from a friend's experience that he told me, they are studying under rigorous, condition. That's number one. I would say that doctors, people that are essential workers, we need to do a bit more for them in order to keep them in the system. First is to give them an environment of study that is conducive. Yes. That's number one. Number two is for us to be able to have enough equipment to support their training. Number three is to make sure that they are getting the practical, the hands-on, because they complain about that too. They are struggling for even stethoscope. So they should have enough resources to use to learn. And the other thing is that a fat package. We must look after them to keep them, because health is wealth.
Mm-hmm. That's true. Thank you so much, Ma. Today on Interview with Experts, we have identified some of the current challenges we face in managing healthcare in the country, our own country, Nigeria. And today we talk about the healthcare facilities that are not running properly. We talked about no funding for healthcare, doctors are not satisfactorily compensated, and we also talked about the hospital supplies and equipment that are not in place. So all these challenges will definitely prevent proper management in healthcare system. So I want to say a big thanks to our mother prophetess for coming on the program today. I know you are busy, just your busy schedule is just awesome to me because it has to do with saving lives, winning souls and everything, included. Thank you so much for coming on to take your time to be on the program. I know shortly you are going to be on another program, and now this time I'm going to release you to go. But then I would say, God bless you, ma'am, for joining this esteemed initiative. It's been a pleasure having you today, and it's been an honor taking you from your important event today to be with us. Thank you so much.
I'm blessed. Thank you, everyone.
Thank
Until
you,
we meet again.
And
Bye-bye.
please, we are going to call you back on the show again. And I'm very sure you will say yes.
I'll surely be back. Thank you, everyone. Bye-bye.
Thank you so much, man. God bless you. Thank you. Bye-bye.
Bye.
All right, that's it on Interview with Experts today. And I'm sure you all enjoy what you see and what you heard today from our mother, Ambassador Ajoke Okubadejo. Thank you so much for watching Healthy Living with Bofa. Right now is our nutrition segment. And I'm very sure it is obvious that you can't wait to see what we got for you today on this program, in this section. Like I promised to revisit our last week nutrition tips, so I'm going to be doing that shortly. But first, let's talk about the our problems that we treated on health segment today, and which is sexually transmitted disease. We have lots of it that have been mentioned. Because of our time, I'm not going to mention it, but I will mention few like syphilis, gonorrhea, HIV, HPV, all those things, they really, really matters, and we have to be very careful. And this can be transmitted through sex, or you can even contact them from your toilet seat. So that is why we have to be very, very careful. Now, let me talk about the few things that I mentioned last week. Natural herbal treatment for various illness, including viral infection that I promise I'm going to mention today. So I mentioned oregano, which I said it exhibits antiviral activities against herpes, diarrhea, and respiratory infection. I mentioned that. I also mentioned basil. Basil, let me see, I have a basil. Okay, this is basil, and I'm sure you all see. You can grab it from any store nearest to you. Basil is right here, basil leaves. They are very, very effective, and this also exhibits potent effect against hepatitis B. It increases immunity, which helps fight viral infection as well. I also mentioned ginger. Ginger is right here. You can get the powder. You can also get the something like this, the roots. You can blend it, put it in a jar, like a glass jar, and keep it in your refrigerator. If you don't have the refrigerator, use it at once. Blend it. You can extract the juice. Add honey and lemon with it and drink. It also reduces weight. When you are overweight, you want to diet, you want to reduce your weight, you can also take it every morning. But trust me, they all work for these infections, especially STD. Any STD, you should take it, it's going to work for you, except if it's something else. So another thing I mentioned is, I mentioned turmeric right here. You can also grab your turmeric. Let me see if you see it properly. Okay. I mentioned turmeric right here. You can grab this. You see, I use turmeric for so many things. I use it for my skincare. I use it for my food. Instead of using curry that you added to your jollof rice, I use this for my rice. I use it for my stew. When I blend pepper, I use it. I also add this ginger to my pepper. So you can add it to your pepper before you blend it together. Every time you want to blend your pepper, put ginger. It goes a long way treating all the germs, infection, disease in your body. So turmeric also is also awesome when it comes to properties, fighting bacteria, infection. You can also add honey to your tea. You can take coconut oil, you can take lemon, you can take onion, olive oil. I use olive oil on my skin. I use it to fry my egg. I use it to do so many things. You know, that's what I use olive oil for, because they are very powerful. It has fatty acid, which will equally give you omega-3. And you can also take fish to get your natural fatty oil, which is omega-3 as well. I mentioned garlic. Garlic, this is oregano. I'm not sure if I showed this one, oregano. It's also in the seasonal section. You can get oregano, basil, and parsley also. This is parsley. They are all, as you can see, they are all seasonal. This is what I put in my food. I boil my meat, my poultry, my fish, everything. I use this to prepare my food. They are very medicinal. And another thing I'm going to mention is cinnamon. Cinnamon is very powerful too. You can also use cinnamon. Is the best in warding off a variety of diseases. So you can go for it. I'm not sure if you see it right here. Cinnamon, you can add it to your tea. You can put it in your salad. Anyhow you want to take it, just make sure it gets down to your body. Now, here are the best way to prevent yourself from urinary tract infection or STD. You want to drink water every day, at least 8 glasses of water per day. You see, I have my water next to me. I always drink it. You know, when I'm online to do program, I have to drink warm water to clear my voice. So taking whether hot or cold water, I still take my water every day. Please, you need to do this if you having this urinary tract infection or any STD. Drink 6 to 8 glasses of water per day. It is very important. You want to urinate as soon as you feel the need. Many of us, it happens to me too, I'm not going to lie, because we have to tell the truth. Sometimes when I'm in a place, maybe I'm driving a long distance, I get pressed, I don't know how to do it, I park. The worst is I'll get ticket. Isn't it better to get a ticket than to hurt myself internally? So urinate as soon as you feel the need. It's very important. Many of us hold this urine inside us. It's not good. It's hurting and it can damage our bladder. So please do that. You also want to take showers instead of baths if you have urinary tract infection. I'm talking about the people that have that. If you sense that something, all the signs and symptoms that were treated, mentioned on Health Corner, please, if you have any symptoms of such, all these I'm saying right here, you want to do them. You want to take showers instead of bath. Shower is when you stand on and you have water dropping on your body, or you pour water in the bucket, you are pouring it on yourself. That is called shower. And if you want to take bath, maybe you have a bathtub, you lay down there, you are not showering, you are not doing anything to your body, that is not shower, that is bathing. Now, another thing you want to do, you don't want to share your towels or clothes with anybody. It's not even hygienic. You can just you can use towel and share it even with your husband, with your spouse. You can't do it. because you don't know the type of infections or germs or bacteria he or she is carrying around the house. So you don't want to share towels or clothes with anybody. You also want to wear cotton underwear. Your panties, your bra, it has to be cotton type because they have effect on our skin, especially our panty. You call it pants in Nigeria. So we call it pants here. So you want to underwear, you want to wear cotton underwear. Another thing you want to do is you want to change your underwear daily. Many of us wear the same underwear for 2-3 days. No, you can't do that. Even if you don't have any infection, it is totally wrong to have one underwear for 2-3 days. Even within 24 hours is too much. Once you take your shower in the morning, you go out and do whatever you want to do, your daily activities. Getting back home, you need to take your shower at night. Even if you stay home all day, you take your shower, you still need to change your underwear daily. You want to urinate before and after sexual activities. This is very important, and I have to emphasize on this. It is normal to have sex with your spouse, but it is another thing to know how to take care of your body. I'm talking to ladies now, and men can also copy from this. Ladies, if you know that you want to have it with your man, please, before and after sexual activities, before you get down there, before he get down there, please and please urinate. It's very important. Urinate before and urinate after to clear, to clean, to, discharge all those things inside of you. You are as well preventing yourself and your partner. It is very important. Now, you also want to avoid using a diaphragm, a spermicide, and a change to an alternate form of birth control. A lot of us have different type of birth control. We have IUD, we have a batch, we have injection, we have a ring, and so on. You can't be on one birth control ever. You want to change it. You want to talk to your gynecologist to see what is going on. And once you have it put on, you also want to check it regularly, because some birth control cause cancer in our uterus, in our cervix, and so on. So please do this. It's very important. And this message is for men. Men, you want to use non-spermicidal lubricator condom. You don't just go to the store and purchase any condom. If you are preventing yourself from sexually transmitted disease, any infection that you think you don't trust your partner with, so use non-spermicidal lubricated condoms. It's very important. And women, please wipe from front to the back after urinating. Don't bring the bacteria from the back. When I say from the back, I mean anus. Don't bring it to the front, to your vagina. Don't do that. Wipe from the front to the back. It is very important you do this. You don't bring the germs, the bacteria from the back to the front, because front is more wider. It is the big opening in our body. And it's, anything can go there easily, ignorantly. Please make sure you wipe from the back from the front to the back after urinating. And when you do number two is dedication. Use tissue to clean first Then if you have water available, use water to wash yourself. It is very important. Ladies, don't use douches or vagina spray. Don't spray your vagina because you want to smell good to your partner. You don't need it. Those sprays carry chemical that can cause problem in your body, especially in your cervix, in your uterus, your vagina. They carry just unbelievable, chemical. So please don't use douches or vagina spray on yourself. Once you clean yourself, wash yourself properly, you can use vagina feminine wash. It's everywhere. You can get it from the store. Once you use that, you're good to go. You can also drop vinegar, apple cider vinegar in the water and wash yourself. You can also use lemon in the absence of vinegar. Use lemon, put 2 drops or 3 drops of lemon in your water to wash yourself. You will dry, you will smell nice, everything will be perfect and your partner will enjoy it. Trust me. Above all, which is very important, look after your nutrition, your hygiene, and overall health. What I mean is eat well and exercise regularly. When you are exercising your body, you are at the same time exercising every organ in your body. So please eat well and exercise. And lastly, if you have any reason to worry after having sex, then you should always get yourself checked with a doctor. You have sex today, you're thinking, oh, maybe I'm not safe. Maybe she did it somewhere. Maybe he has done it somewhere that you don't trust. Then you need to see your doctor and check yourself. It is very important. And finally, the only way to absolutely guarantee that you don't get STD is, unfortunately, is not to have sex at all. I know this is not going to go down with some people. It is not going to be an option for a lot of people, but trust me, it does. Of course, presently right now, and I'm going to say it, the best course of action, if you have any concern, is just to abstain from sex. That's it. Abstain from sex is very important. So practicing safe sex is the best option. Practicing safe sex is the best option. I know you have to do it. It's okay. You can do it, but make sure it is safe while you're doing it. It's very, very important we do this. And I hope we help someone feel better today. If you are going through any problem that relates to what we treated today on this program, please watch this program again over to take care of yourself. And don't forget to share this program with others. It is very important. That is all we can give on this program when it comes to wellness. I wish you all good health. Once again, thanks for joining us and staying with us on Healthy Living with Bofa today. I'm Betsy Olayinka Folani Akinlosotu, aka Bofa, reaching out to you today on health and wellness. There's nothing we can do to that. I want you to believe that I love you all, and I will be bringing to you live information on health and wellness. So I'll see you next week by God's grace. God bless you. God bless me. Love you all. Bye.